If you're over 60, every decision you make, what you eat, how you sleep, how you move directly impacts your heart. But what if I told you that there is one daily habit that is quietly destroying your heart every day? As a cardiologist, I've seen too many older adults come into my office feeling fine and leave with a diagnosis of high blood pressure, clogged arteries, or worse, at risk of a heart attack. Most don't even realize they're doing something dangerous. It's not just fast food or lack of physical activity, it's one simple thing they repeat every day without thinking. That's slowly pushing their heart toward failure. In this video, I implore older adults to quit this one bad habit and more. I'll also reveal the 10 most dangerous habits that are currently destroying your heart. Each of them increases the risk of heart failure, stroke, or sudden death. But the good news is that they are all reversible. You just need to understand what to stop and what to do instead. Watch to the end. The first habit, the most important and most common among my patients. And we'll start with the 10th, skipping daily walking or exercise. If you're over 60 and don't move daily, you're inviting heart disease. One of the most common mistakes I see as a cardiologist is that older people spend all day sitting in front of the TV, reading a book, or in bed. You may think, I'm too old to exercise, but I'm not asking you to go to the gym. I'm asking you to just walk. Just 30 minutes of walking a day at a comfortable pace can reduce your risk of heart attack by almost 50%. If you don't move, blood flow slows, fat begins to deposit in the arteries, the heart weakens, and blood pressure rises. Over time, this leads to heart failure, stroke, or death. Walking improves circulation, oxygenates the brain, reduces stress, and helps control weight, blood sugar, and cholesterol. It's free, requires no equipment, and is one of the most powerful heart medicines. Just 15 minutes in the morning and 15 in the evening, and your heart will be protected. Don't wait for chest pain too. Start moving. Prevention starts now. Your heart will thank you for every step. Most older people don't realize how dangerous salt is, and it's not just the salt you add to your food, but the hidden salt in soups, bread, sauces, pickles, chips, and processed foods. Excess sodium causes the body to retain water, increasing blood volume and arterial pressure. Over time, this leads to hypertension, which silently damages the heart, kidneys, and brain. It's not for nothing that hypertension is called the silent killer. I've seen many cases where the sole cause of a patient's heart failure was a habit of eating salty snacks every day. Older people need less salt than younger people. No more than 1,500 milligrams per day, that's less than a teaspoon. Always read labels and avoid processed foods. Cook at home, replacing salt with herbs and lemon. Even small changes, such as switching from salted to unsalted nuts or avoiding frozen meals, can save the heart. And remember, taste buds adapt. In just 2 weeks, with less salt, food will seem just as tasty, and your heart will function better. Reduce salt before it shortens your life. 8th, fatty and processed foods for breakfast. Breakfast should provide energy for the whole day, but for many older people, it has become a real trap. Bacon, sausages, buttered toast, sugary cereals, fried eggs, creamy coffee, all this may be delicious, but it damages the heart more than you think. Such dishes contain saturated fats, trans fats, and sugar, raise cholesterol, blood pressure, and cause vascular inflammation. I've noticed an alarming pattern. Most heart attacks occur in the morning, shortly after such breakfasts. Why? In the morning, blood is thicker and heavy foods make the heart work harder. After age 60, the body can no longer cope with such stress. Choose healthy alternatives: oatmeal with berries, boiled eggs, whole grain toast with avocado, fruit smoothies. These dishes lower cholesterol, improve digestion, and give you energy without harming your arteries. Breakfast can be medicine or poison. The choice is yours. 7th, regular alcohol consumption. You've probably heard that a glass of wine is good for your heart, but after age 60, such advice can be deadly. Alcohol affects the body of an older person differently. The liver processes it slower, blood pressure rises faster, and the risk of arrhythmia increases dramatically. I've seen patients with heart failure, stroke, and atrial fibrillation, and all because of 2 glasses a day. Alcohol damages the heart muscle, promotes the accumulation of fat around the heart, and causes inflammation. It also interferes with the effectiveness of medications for blood pressure, diabetes, and cholesterol. Many older people drink to relax or sleep, but in reality, alcohol disrupts sleep and increases blood pressure at night. Even small daily doses cause harm over time, and if you already have heart disease, alcohol becomes even more dangerous. I always recommend abstaining completely, but if you do drink, limit yourself to 1 glass no more than once a day and certainly not every day. Your heart will become stronger, your sleep will improve, and your overall health will stabilize. Alcohol may dull stress, but it weakens the heart. Don't let one drink turn into years of regret. 6th, suppress stress and anger. Hiding stress, anger, or sadness may seem strong, but in reality, it deeply wounds your heart. Emotional stress increases cortisol and adrenaline levels. Your heart begins to beat faster, blood vessels constrict, and blood pressure rises rapidly. Over time, this leads to heart attacks, strokes, and sudden death. I've treated patients with a perfect diet. But with heart disease, it's all due to chronic internal tension. Family problems, money worries, loneliness. If you don't express your feelings, the body suffers. Many elderly people say, "I don't want to burden anyone," or "I've been coping my whole life." But after 60, the heart can't withstand the storm of silence. Talk to someone, join a senior club, meditate for 10 minutes a day, take deep breaths. Even simply keeping a journal reduces internal stress. Underestimate the power of emotional pain. The heart isn't just a pump. It senses what your mind carries within. Calmness is the most powerful medicine. The more often you experience your emotions in a healthy way, the longer and stronger your heart will work. 5th, ignoring sleep apnea and snoring. Snoring may seem harmless, even funny, but it could actually be your heart's cry for help. Sleep apnea, a condition in which breathing periodically stops during sleep, affects millions of older adults. It depletes oxygen levels, disrupts rest, and over time causes serious damage to the heart. Many don't even know they suffer from it. They feel tired, wake up with headaches during the day, and have memory problems. But they don't attribute it to sleep. I always ask my patients about snoring. Why? Because apnea increases the risk of hypertension, arrhythmia, stroke, and sudden death. If your partner says you snore loudly, choke, or stop breathing in your sleep, get checked out. A simple overnight test will provide the answer. SPEPS devices or special mouth guards protect the heart at night. Quality sleep is when the body recovers. Without it, the heart suffers in silence. Don't ignore the signals. A horn is not just a sound, it's a warning. Your heart needs oxygen all night. Improve your sleep and your heart will be able to rest. 4th, smoking or inhaling secondhand smoke. Everyone knows today that smoking kills, but many older people still underestimate how dangerous even one cigarette or inhaling someone else's smoke can be. Smoking harms not only the lungs, it destroys the inner walls of arteries, causes inflammation, accelerates plaque formation, and leads to heart attacks. After 60, blood vessels become fragile, and smoke makes them even more fragile and narrow. I've seen patients who never smoked but lived with smokers, and they eventually developed heart disease. There is no safe dose of smoke. Even if you've smoked for 40 years, quitting now can still reverse some of the damage and significantly reduce your risk in just a few months. Don't be fooled by light cigarettes or vapes. They are just as harmful. Your heart deserves clean oxygen and clean blood. Every breath of smoke is a blow to your heart. If you're having trouble quitting, see a doctor, find a support group, use nicotine patches. The most powerful thing you can do for your heart is to say, "I quit." Your body will begin to recover the next day. 3rd, using phones or watching TV late at night. Late night screen time may seem like a harmless habit, but it quietly increases the risk of heart disease. Blue light from phones and televisions suppresses the production of melatonin, a hormone that regulates sleep. Lack of sleep leads to a loss of energy, high blood pressure at night, metabolic disorders, and additional strain on the heart. Older adults often scroll through their news feeds before bed or leave the TV on for company, but this disrupts the body's natural rhythms. As a cardiologist, I see poor sleep as one of the most powerful triggers for heart attacks, strokes, and arrhythmias. But it's not just light. It's also mental stimulation. News, social media, movies, all of this increases stress levels, accelerates the heart rate, and excites the brain when it should be resting. Over time, this prevents the heart from resting during sleep. I always advise turning off all screens at least an hour before bed. Instead, enjoy a book, soft music, or light stretching. Your sleep will improve and your heart will be grateful. Remember, it's at night that the heart heals. Don't deprive it of this time. Sound sleep, sound sleep. Heart 2. Frequent consumption of fast food and fried snacks. Fast food and fried snacks are convenient but deadly for the heart. These products contain trans fats, saturated fats, and salt, all the things that damage blood vessels. Older people often grab a burger, samosa, French fries, or a piece of fried chicken, thinking, well, once is no big deal, but each such meal increases. Cholesterol causes inflammation and thickens the blood. I've seen heart attacks caused by years of such simple snacks. Blood vessels become dense and narrow, blood flow is impeded, the heart is forced to work under pressure, until one day it simply can't take it. After 60, metabolism slows and the heart becomes more sensitive. Fast food has no benefit but maximum harm. Choose baked, boiled or steamed foods, snack on fruits, nuts and homemade soups. Even replacing frying with an air fryer is already a step forward. Remember, what you eat becomes your blood. If the food is fatty, so is your blood, and thick blood is a blockage. You can't build a strong heart on weak foods. Say no to the temptation of fried foods and give your heart a chance to live. First, ignoring high blood pressure or refusing medication. This is the most dangerous and most common mistake I see in the elderly. Many feel fine and stop taking their blood pressure pills. But hypertension is a silent killer. There are no symptoms until the heart, brain, and kidneys begin to deteriorate. Missing medications, even for a couple of days, can cause sharp spikes in blood pressure, leading to a stroke or heart attack. I've treated patients who lost consciousness simply because they ran out of pills or decided they no longer needed them. Medication isn't a prescription. It's your lifeline. If you experience side effects, don't stop. Talk to your doctor about changing the dose. Measure your blood pressure at home, record your readings and take your medications at the same time every day. Use reminders or organizers. Regularity is key. High blood pressure thickens the heart muscle, narrows blood vessels, and leads to heart failure. But it's completely controllable if you take it seriously. Don't gamble with your life. One pill a day can save you years of suffering. Take control and your heart will beat steadily. Your heart beats for you every second of your life, asking for nothing in return. But after 60, it needs your support more than ever. Every habit you follow, every food choice, every walk, it all contributes to the fate of your heart. I've seen too many patients ignore the little signals, the little warning signs, until it was too late. But you have a chance to change everything. Start by giving up just one bad habit, and then step by step eliminate the rest. Your heart doesn't need perfection. It needs care, stability, and your attention. And if you feel like things are difficult, don't be alone. Take care of yourself, maintain your strength, and take care of your heart every day. Yeah,